In terms of preventing skin cancer, and you mentioned, avoiding the sun, obviously, but sometimes we can't because we play sports, so we're outdoors. Of course, we wear a hat, but mainly we use sunscreen. At least I do. And in the sunscreen, we see SPF, sun protection factor, 30, 50, 70, 10. So what's the ideal number for SPF for adults and for children?
Okay, so the ideal number for SPF is basically probably a number about from 15 or higher. And all that number means is it means that if you take a person and you expose them to sunlight with ultraviolet light A, or in this case, ultraviolet light B usually, what happens is that it's going to take a certain period of time before they're going to start burning and getting damaged from that ultraviolet light. So that number means that if you have a number of 2, it's going to take twice as long before the person burns and gets damaged. If they have a number of 3, it may take 3 times as long. If you have 4, 4 times as long. So by having a number of 15 or greater, it means that it's going to take that much longer before the person can burn and get the damage from the radiation from the sun. It doesn't mean that they can stay out all day, and it doesn't mean that they're completely protected. It just means that it takes longer to protect them. So having a number of at least 15 or greater will give you more protection. Now, early on, I mentioned ultraviolet light A and ultraviolet light B. Ultraviolet, there are 2 types of radiation that comes from the sun. B is the one that we're usually most familiar with that we get burnt from. So when you get exposed to ultraviolet light B, you get a red, and then you burn and you peel or you blister. When you get ultraviolet light A, you may not necessarily get very red at all. You may not necessarily even feel like you have a burn, and it does stimulate color formation, which means that you could end up getting a tan from it, which is why many people think, oh, well, A is protective because it gives me a tan and that protects me. Well, the fact that you get a tan, what the body's telling you is that it's trying to protect you from damage. So the fact that you're getting a tan means that that light is causing damage and causing injury enough that your body's trying to protect you by creating that tan. And that tan is not efficient enough to give you the protection that you need, but it's certainly a little protection that's there. So neither ultraviolet light A or B is good for you in excessive doses, which is why we have what comes basically as the SPF factor, which is that when you have the sunscreens, you look and see how much longer you can stay out there. Again, the bigger the number, the more you can stay out there. And it has to have protection against A as well. So the SPF is usually protecting from B. And what you want is a sunscreen that has broad spectrum protection so that it has protection from A as well as B.